Okay, this was a pretty simple video. It's just me having a conversation with a Dr. Aaron Horshig, aka Squat University. He texted me on Instagram to ask me about whether the Chinese coaches do recommend that your knees collapse inwards like this. And I'll just read the important points of our conversation from him. So he says, I've been in discussion with a number of people about dynamic valgus, basically the knees caving in a lot is the key word here, at the bottom of a squat, clean or snatch. Now, I'm specifically referring to a lot of internal rotation, like the knees almost touching. One person in the discussion referred to your video to make a point about allowing the knees to roll in as an advantage. And then he watched the video about me pushing, saying, talking about the knees going up, and then he said that didn't seem like the point of your video at all. His question was then, have you personally thought about the idea that a knee collapse or a valgus collapse is okay? So my response, I don't recommend a valgus collapse at all. I think all coaches should be able to identify when a collapse is happening, or what seems like a collapse from the internal rotation of the hip at the initiation of the ascent. Okay? The idea that we use here is to keep the Asian squat trifecta, aka the tripod point 1, point 2, point 3, stable. What this does is it creates a very stable base for the tibia to stay in place. When the tibia does not collapse inwards or push outwards, the knee is in a much more stable position. When the knee is in a much more stable position, you create a chain of stability right up to the hip and the back. That's giving you a more stable squat. Okay, so let's go on. Awesome, that's exactly what I preach. There's a number of people who think that a collapse should be allowed. Many citing the Chinese lifters and athletes who do it. Okay, so the response here is, when the tibia is in a firm position, all we need to do next is to feel the engagement, the stretch of the glute during the descent. Stand up with those same muscles that you stretch during the descent. That and simple, up and down, squat, deadlift, pull, whatever. They're all done in the same manner, almost. Just different variances in the angle of your torso because of where the bar is placed and what you have to do with the barbell once it passes the knee. A collapse of the knee will not engage the adductors and the glute maximus. Only the deliberate usage of the glutes, the hamstrings, the adductors via specific controlled and coached movement will allow that. That is not a valgus collapse. Of course, the coach will have to see this in order for it to be able to be coached. Okay, agreed. Glad we're on the same page with that. I was confused when somebody threw out your video into discussion after watching what you had to say, as what I had to say. And it's like, I continue to reply. It's important to note there is no specific cue of knees out or knees in China. In many of the countries that I've traveled to, I have never heard knees in, knees out outside of the CrossFit fitness, CrossFit fitness powerlifting circle. It's a very commonly used cue in those circles of training, not in the weightlifting circle. Now, this is not a knock. Once again, this is a differentiation of the cultures and the words that we use in different cultures, in different sport cultures. Okay, cueing the knee for a squat is akin to cueing the elbow for a tricep extension. There is relevance, but we can look elsewhere along the line of the movement first. In the case of a tricep extension, look into the shoulder. Maybe it's a shoulder positioning that doesn't help engage the triceps as well. In the case of a squat, look into the hip first, look into the foot first. Don't look into the middle joint so much. And then we had a little laugh about something, blah blah blah, you don't have to know about that. Okay. And he came to a point and said, I always say cueing knees out only works to a certain point. It is used to cue lifters with collapsed knees to realign the body. So keep it up. If the knees are doing this, it's collapsing, then you tell them, keep out your knees. Once the lifter understands this, you can begin to use better cues to create more effective movement patterns. Okay, once you have your knee in alignment with your foot, you shouldn't use that cue anymore because you can become unstable again in the opposite way, meaning too far out, and roll your tripod foot to its side. Thank you, Mr. Squat University. Okay, and then I discussed about how we continue to teach, which is number one, you have to learn the pattern that creates the least resistance, most power, least pain, least thinking from the start of the pattern, in the middle, and the end of the pattern, which means during the start, during the middle, and during the end, this movement that you choose to create cannot create pain. No way, nothing. It cannot create pain. Pain is telling you, nope, don't do it. No pain, no gain. When it comes to technical perfection, it's stupid. It doesn't work. Create the least amount of thinking. So let's just say, for example, we go back to a squat. Right over here, a lot of people like say, oh, how am I going to control the descent? So you have to find for a way that allows you to do it without thinking. In this case, I found a way to do it. I don't know what I'm doing. I just know that I can do it. Why? Because I come to a point where I've analyzed my own squat technique so much that it's just no thinking. Just do. Okay, so it's very important during the start, middle, and end of the pattern. No pain, no resistance, no thinking. Okay, as little as possible. Do tons of variation to point out the issues that you accidentally hide in your default method of squatting, pulling, or anything whatsoever. These movements are then broken into micro movements. So example, start, middle, end. We'll break that down again. We'll break that down again with the accessory movements to point out what are the mistakes that we are hiding. I remember my teacher for neurokinetic therapy, NKT, she said that athletes, along with Dr. David Weinstock, I think, they both said that athletes are superb compensators and superb people that hide mistakes really, really well. Okay, so you need different movements, single unilateral movements, to also point out these mistakes. Now, once you have found out what these mistakes are, transfer all those lessons to your default desired pattern. So if you learn, for example, that you're twisting one side during a unilateral pattern or during a wide squat pattern, when you're going back to your default squat position, pay attention to that twist. Do so much volume and variation. Volume is key. Volume is super important. Variation is the second thing as well. You create too much specificity in the movement, you are going to get injured. But you don't create enough specificity, you don't get enough improvement. So you create variation in the specific movements. So for example, if I'm typically doing a squat, I can go wide stance, I can go pause, I can go super narrow stance, I can do front squats, I can even use overhead squats as an apparatus to teach the squat, but with variation. Okay, sounds like a great plan. I teach a similar progression to finding weak links in the squat pattern. As a physical therapist, I often use a single leg squats as a screening tool and training tool. Fantastic. And yeah, so the rest of it, as a physio, who's someone been involved in weightlifting for over a decade, he's trying to educate everyone on the proper mechanics of the squat, and that's why he started Squat University. Okay. Now, we had a little laugh at this, okay? I said to him, it's not that different from what we do. We cue differently, but knees collapsing like that, not okay, has never been a cue or something that we accept. There are times that the coach may say ya tui, which means in Mandarin ya tui, which means squeeze or press onto the thighs. This cue can occasionally create a little bit of an internal rotation of the hip. So it goes ya, like that. So watch. So it's coming down, it goes ya tui, and that creates that tiny little bit of internal rotation. That is not a valgus collapse. Okay, the variance of the move, the range of the movement during that squeezing is what determines if it's actually a valgus collapse or a squeezing of the muscle. So this is not this. Okay, I know it's funny because a small rotation or waver in the knee, like what I've said, is not a collapse at all. The knee has to collapse inwards to a much greater degree to be labeled that. Be a bit smarter about things, and you'll be able to coach yourself a lot better and coach a lot of people a lot better. So don't take things at face value. That's my tip, and I believe Squat University would agree to that. So you can check him out on Instagram. It's at squat_university. Great content. I follow him as well to learn a lot of things. And yeah, if you have any thoughts, if you have any discussions or recommendations that you would like me to pursue, do tell me. Cheers. By the way, I apologize about that. My landlord's quirky.